the glenohumeral joint. This is also called the shoulder joint. So for these ones, I recommend you to look at the bones first. That will be easy to remember it, okay? So look at here. This is the scapula. Scapula, you can see one bony marking here. This is called coracoid process. This is called acromion, and this is called the glenoid cavity. So there's three different anatomical features of a scapula. So this is one bone. The second bone is the clavicle, and the third bone is the humerus, and this is the head of the humerus, and this is the neck of the humerus, okay, and this is the diaphysis. So once you recognize these anatomical features of the bone, it's easy to think of the ligaments. So look at it here. This is the coracoid process, is connecting with the clavicle, and that's why these ligaments are called coracoclavicular ligament. Very easy to remember. Another one is connecting the coracoid process with the acromion. So this ligament is called coracoacromial ligament. Another one is connecting acromion with the clavicle, and that's called acromioclavicular ligament. See, it's so easy to remember. So these are the ligaments. So there's other stuff here is also there. This is one bone. This is another bone, right? So this is the synovial joint. So it means that it's covered by a cartilage. This is articular cartilage, which is made by what type of cartilage? Hyaline cartilage. Okay. Inside there is a cavity there, which is called joint cavity or synovial cavity. That is filled by the synovial fluid. That synovial fluid is coming from where? From the synovial membrane. This is the synovial membrane, okay, which is located deeper in the articular capsule, which is this. This is the articular capsule. This is the articular capsule, which is made by this irregular connective tissue. So this is one thing that you see in all synovial joints, a similar thing that you see. Then there are some other structures that you see. One of them is the supraspinatus muscle, tendon. When we get to the muscles, we will talk about that in more detail. And this one, actually, look at this one. This is called the subdeltoid bursa. Remember bursa? That is a pouch that contains synovial fluid. So in any area there is a lot of frictions and movements, you have these pouches. So this is located more laterally. Subdeltoid is located more laterally below the deltoid muscle. There is also another one that is located below the acromion. So I will show you the next image. You see that there's one below the acromion, but this is located more laterally. So here again you look at these bony structures first, and then we can talk about the joints. Okay, so this is the scapula, right? So this is the glenoid cavity here. This is the coracoid process. This is acromion, and this is the humerus. So look at the ligaments here. This is one is connecting the coracoid process to acromion, and that is called coracoacromial ligament. This is the coracoid process, and this is the humerus. They are connected with each other by coracohumeral ligament. Okay, this is the glenoid cavity, and this is the humerus. They are connected with each other by the glenohumeral ligament. So this is this is a capsular ligament. So this is why this whole area is the capsule. So it's hard to see it in this view. It is located anteriorly, but it's hard to see it. I will show it to you in a different image that you can see it is attached to the capsule. That is why it's called capsular ligament. Another one is located only on the humerus, so it's not going into any other bone, but is located above this tendon sheath, and this tendon sheath is wrapping around the tendon of the biceps muscle. So going from one area of the humerus to another area, and that's why it's called transverse humeral ligament. This area of the scapula, if you remember it, that's called subscapular fossa, that subscapularis muscle attached there. And this is the tendon of the subscapularis muscle. Below the tendon, you have a bursa here, that is to reduce friction. And another one that I told you before, that's below the acromion, and that is the subacromial bursa. So sometimes people come with a shoulder pain, and there's a way to expose these ones. So one bursa is here, that is the subdeltoid, and this is the subacromial. So depends on which one is more painful, then you can do an injection of steroids, and that way you can reduce the pain. So this is a common procedure for shoulder pain. This is if you can see it from a lateral view of the shoulder joint. So again, let's talk about the ligaments because that's easy, straightforward. So look at the different bones here. This is the scapula here, this is scapula here, this is the coracoid process, this is the acromion. So both of them are part of the scapula. They are connected with each other by coracoacromial ligament. Coracoid connects with the clavicle through the coracoclavicular ligament. So nothing new, it's all same information that was before. Acromion to the clavicle connected by this ligament, and that's called acromioclavicular ligament. Same idea, nothing new. So now here, look at it. Okay, so this is the capsule of the shoulder joint. This is the glenoid cavity. Okay, this is the cartilage, this is the hyaline cartilage that is located on top of the glenoid cavity of a scapula. And this thing that you see, this is actually a fibrocartilage that is extending the joint. So it's a fibrocartilage, it's stronger. So the capsule is made of dense irregular connective tissue, right? And you can also see these ones. You see these ones? So these are ligaments, which is dense regular connective tissue, and this is the glenohumeral ligament. So from glenoid cavity it goes to the humerus, and it is attached to the anterior part of the capsule of the shoulder joint, and this is called the capsular ligament. So you can see it here better because it's attached to the capsule, but from the anterior view it's a little bit difficult to see. I told you that the shoulder joint is the most mobile joint, so it means it has to wrap around by different structures. The most important ones are the tendons and the muscles to increase the stability of those joints. And now you can see the whole joint is wrapped by different muscles. So let's look at it. This is the supraspinatus muscle tendon. This is the infraspinatus muscle tendon. This is the teres minor, and this is the subscapularis muscle. So the whole shoulder joint is covered by these four muscles and tendons. So the abbreviation of these muscles are called SITS, sits muscle. So sits muscles, okay? And if somebody is using the shoulder a lot, for example, somebody is a painter or a boxer or maybe a golfer, tennis player, then they are at a higher risk of shoulder damage. That is called rotator cuff injury. Rotator cuff injury. Okay, so in the rotator cuff injury, sits muscles are damaged. You also see these bursae here. One is below the acromion, so that is, one is below the coracoid, so subcoracoid. This is below acromion, so subacromial, and this is below the subscapularis muscle, so that's called subscapular bursa, because there's mobility, a lot of mobility in the shoulder joint, so you have multiple bursae there.